Welcome back to another episode of the Association Spotlight Series. I'm the host, Lake Morehouse. Today we're joined by Katie Hackney from Highland Hospital. Katie, thanks so much for joining us. I really appreciate you coming over. And you want to just kind of introduce yourself a little bit to our listeners and tell us about what you do at Highland. And yeah.
Okay. Well, thanks for having me. My name is Katie Hackney. I'm the Chief Operating Officer at Highland Hospital, Charleston, West Virginia. We are located in the Canal City area. And I've worked for this facility for about the past 12 and a half years.
Wow.
And I started as a case manager and psychometrician, and I've kind of just advanced to different other roles in the facility, and I love what I do.
Oh, that's great. Yeah. And we were talking a little bit earlier here before we sat down that you have a unique story kind of starting at Highland.
I do, yeah.
Yeah, you want to tell everyone about that? That's pretty cool.
Sure.
Yeah.
So I actually graduated from West Virginia University with a bachelor's degree in psychology back in 2013. I graduated on a Sunday and I started at Highland on Monday. So I've kind of grown up there and I've never left. There just happened to be a position available at the time at our outpatient facility, which was called Process Strategies, which was the outpatient facility of Highland Hospital. And I would do part-time work at Highland and part-time work at Process Strategies. And then a position became available full-time at the hospital. So I moved up there full-time and I've been there ever since.
Wow. So. That's so cool.
Yeah,
you don't hear a lot of that. So how, in terms of different positions through Highland, how's your career path kind of been shaped, and how's that kind of, you can walk us through that a little bit of different titles you've held?
Yeah. So as I stated, I graduated with my bachelor's in psychology in 2013. I worked as a case manager and a psychometrician doing psychological testing for the first year or so. And I took off 1 year just to kind of work full time and kind of understand what I wanted to pursue after that. And then I applied to obtain my master's degree from Marshall University, also in psychology. So I pursued that full time while working full time at Highland. And after I graduated with my master's degree in 2016, I started doing therapy with the patients at Highland, moved on to supervision, program management of a couple of our units. And then back in 2019, I became the director of clinical services, where my main role was to oversee the therapists, social workers, case managers, activities department. So I learned a lot clinically during that time. And then back in January of this year, I became the chief operating officer.
Wow. Yeah. Congratulations.
Yes, thank you. So I've learned quite a bit over all of my years at Highland, and I've really appreciate all the opportunities they've given me to really advance healthcare.
Right. And they've been a member of ours you all have for a while now. We love Highland, and it's great.
Thank
you all
you.
do incredible work. So in all of your time here at Highland, how have you kind of maybe seen the behavioral health landscape change across the state? As we know, there's been some good trends that we're starting to see a little bit come out of the opioid epidemic, with some decrease in overdose deaths and some good optimism there. Some things are kind of taking a turn for the right way, but it's been an uphill battle for everyone across the state, not just in West Virginia. So maybe kind of have you seen that landscape kind of change for the better? And
Absolutely. So obviously addiction is something that is ever present throughout West Virginia, and that's very unfortunate. But I think that because the statistics were so high and the overdoses were so high, and it's been such a problem throughout our state for so many years, it takes something like that for people to really take it seriously and take a stand.
Right.
And so, we had lobbyists, we had politicians, we had clinicians all sort of work together to ensure that, West Virginia has really become oversaturated with detox facilities, with mental health facilities, with substance use facilities, really. And so I think that it's been a wonderful thing, a wonderful transition over time, that it's been taken so seriously that we do have so many more options for treatment.
Sure.
I think also, so many people have lobbied and worked so hard to ensure that people are given the option of treatment rather than incarceration.
Right.
And that's been such a help, I believe, as well. On the other side of that, we also see a lot of children come through our facility who are victims of families who face addiction.
Right.
And so that can be very challenging as well. But I do think that, because it has been such a big deal throughout our state, that it's given everybody a more eye-opening experience.
Right.
And everybody takes it a little more seriously now. They understand that it's an illness that needs treatment rather than punishment.
Sure.
So
absolutely. Yeah. And like you said, we can kind of touch on the challenging aspects of what you all see and do. And it's great work. And
thank you.
It has to happen. So I know in a lot of behavioral health, there's a lot of the work is very tough and it's very challenging. And it comes,
Absolutely.
and how do you kind of maybe turn off a little bit from what you see and things you deal with, and kind of not turn it off in that way, but it's I'm sure it gets tough, and maybe some things that make you feel good about it. It's because it is tireless, hard work.
It very much is, and it can be very, very challenging and very heart-wrenching a lot of the time.
Right.
I think the more time that you do spend in this field, you learn to sort of not necessarily desensitize, but it's sort of a defense mechanism that we have as clinicians who work in this field. It takes someone with a really big heart to work in this field, somebody who desperately wants to make a change and help people. And some days you go home and you feel like, have I really done anything at all to help?
Right.
And then other days you may go home and, you feel that you did help someone that day, or more than one person that day. I think it's really important to separate it. We all have baggage, and we have to leave our emotional baggage at the door when we walk into work. And we need to leave our work baggage at work whenever we go home.
Of course.
We owe that to our families and our loved ones, and we have to be the best version of ourselves in all aspects of our lives.
Right.
So I think it's really important to find things that you can focus on to, for example, for me, I spend time with my family, with my animals. I attend church. I spend time with my loved ones. And so you really have to have avenues that you can sort of reach out to cope and to sort of forget about those things that happened at work that day.
Right.
It definitely makes you grateful for the life that you have whenever you see so much struggle every single day. So it's definitely very, very difficult at times to separate it, but you have to find unique things that work for you to really separate that. Yeah,
absolutely. And we can kind of parlay that into a little bit of, we talk, of course, the workforce shortages across West Virginia in behavioral health are no secret, and it's a constant battle to kind of, we're trying to, boost the industry here and get more workforce, and it's tough. Like we've talked about, the jobs are hard, and the work can be tough. But maybe what would you say to someone who's a younger person, or maybe not even a younger person, someone who's looking for maybe a career or industry change, interested in behavioral health in West Virginia? What would you maybe say that, to them about this kind of work, what it can do for you, and any sort of misconceptions or,
Absolutely.
Yeah.
Unfortunately, there's always going to be, I think, a stigma related to mental illness and mental health. And it's a job that's not for everybody. Right. You have to want to work in that field, and it can be scary at times. It can be challenging at times. But I think more than anything, it's very rewarding. And I would want people to know that it's very rewarding. For every few bad days, you're going to have a good day, and you're going to feel like you've really made a positive difference in someone's life. Just speaking solely about Highland Hospital, we, measure success rates from admission to discharge. And we have some extremely high success rates with our patients. And I think that if people who needed a job were to look at our success rates, they would want to be a part of that.
Right. It speaks for itself.
It does. It speaks for itself. In terms of child and adolescent patients, we are seeing about an 80% statistically meaningful improvement from admission to discharge.
Wow.
And for adult patients, we're seeing about a 90 to 95%.
That's incredible.
That speaks for itself.
Yep.
And, aside from that, we were actually just recognized for our being the lowest admission rate, number 6 in the country, actually.
Wow.
Highland Hospital was, for being the number 6 facility in the country for lowest readmission rates rather.
Sure. Yeah.
And so we're helping people.
Yeah,
we are truly helping people, and all of those statistics really prove that. And I think it's really important to show people that data.
Absolutely.
Because why would you not want to be a part of changing someone's life for the better?
It's invaluable. You
Absolutely.
you can't put anything on that. That's what it's all it's all
Yeah.
worth it there.
Absolutely.
Yeah. Well, that's great. Katie, thanks so much for joining us today. Love to hear more about
Yeah.
your career path and Highland Hospital and all the great work you guys are doing over there. So
Thank you so much.
we
for
really
having me.
appreciate you all as a member, and thank you so much.
We appreciate being a member, and thank you for everything.
All right. Thanks.
Thank you.
Bye.